So good evening, everyone. We are privileged to have this opportunity for Dr. Nel to share his journey, Australian doctor journey. Um, I'm so grateful that you connected with me. It's a last minute meeting, and I believe you are from duty and really grateful for making time after a long day. Hello.
Hello. Hi. For a sec, I'll just gonna have to
And welcome everyone. Welcome Paolo. Welcome Bia. Welcome Cyril. Welcome Eli. Welcome Marie and Elveline.
Hi,
Hello.
Doc.
So it's 10 o'clock your time and you're from duty. Really thankful. 10 o'clock your time as well, Paolo, right? Thank you. Thank you, everyone, for making time to do this. And I just met Nell this morning
Mm.
via Messenger. So I don't know anything about you, but for sure you'll give us a background of who you are and why are you here now.
Yeah, so just for everyone, sorry I look very tired. I had a long day. I just got home from work. So I am Dr. Nel. So I'm originally from Cebu, Philippines. I graduated from Cebu Institute of Medicine almost like more than 10 years ago. Yeah, from CIM. Um, and then I aspired to come to Australia starting 2015. So before I'm gonna talk about my journey, currently I am working as a ACRRM Fellow Trainee.
So what is
So
ACRRM first for everyone? I have no idea what's
so
ACRRM.
so ACRRM is a college is a uh, it's Australian College of Rural and Remote Medicine. So it's similar to the different colleges, but I decided to join ACRRM because I have the passion and enthusiasm to work in rural and remote areas. It's in smaller hospitals, being here in North Queensland for almost 9 years now. So I think I couldn't work in a big city. Though I came from Cebu City, but living in Australia, it seems like it's more peaceful and have a better way to and also to those who are aspiring, staying in a regional area has a plus points in your process or in your application when you start applying for a permanent residence or permanent residency.
Absolutely. And
Hence, I stayed here in regional. The reason why I stayed in the regional area. Now, so currently I'm on a pathway to become a fellow, hopefully in the next 2 years with ACRRM and with an advanced skills in emergency medicine or obstetrics and gynae. So for the information of everyone here in Australia, we have the different colleges as well, similar to what we have in the Philippines, but it is more broad and it's more you could choose a lot of colleges and specialty here, more compared to what we have back in the Philippines, where it is more a little bit um, only few choices that
limited
limited.
choices, depends on
Correct.
the specialty, whether medicine, surgery, pediatric,
Pediatric. Yeah,
etc.
correct.
Well, compared to general medicine, there's GP practice, there's general medicine, there's ACRRM, there's College of
Mm.
Physicians. There's a lot of avenues to become a doctor.
Yeah. So it's the in a field of a GP. So a GP in Australia is a specialty. It is not similar to what we have in the Philippines. That as soon as you gain your registration from PRC, you tag yourself as a GP straight away. And we tag ourselves that a GP is those that work as a doctor, but not on a training. So in here, GPs on their own field, they are considered as specialists.
And there's
Um,
6 years of training, isn't it?
yeah, right. So before I'm gonna go to where how I ended up being where I am at the moment. So it was a struggle. I think everyone on the same boat, especially coming from the Philippines, that even up to now, a lot of friends of mine has always been asking, what do I do? And they are already a diplomate and fellow of their own specialty. So those are the things that I want you to remember, that you could still be able to come here even though you're already a specialist. However, there's a bit of a disadvantage of being a specialist back home already when you start coming over here, because when you start coming here and going through a standard pathway, it is better for you to have a grasp of all the field of medicine, because that's how the exams will gonna be. Now, with my journey, going as what I've mentioned earlier, 2014, 2015, I dreamed of coming to Australia because I have a sister who married an Australian. So way back before, it's easier to come to Australia if you marry an Australian. So, but this time it's getting very tighter and stricter now with regards to fiancé visa and all of those spousal visa sort of thing. I am a bit familiar with the process of visa, because all the visas I had in Australia, I processed it myself. I never had any agency or anything. I've done it myself from scratch. So we call it DIY, do it myself all the time. So I came here on a student visa because it's easier pathway for me. The reason why for that is I didn't take the MMCQ first because there is no assurance. So me coming from a very not a well-off family, so I was able to sustain myself and finish medicine through a scholarship from CIM. So CIM faculty provided 100% scholarship on me when I studied medicine. So under the faculty development scholarship program, because the goal was for me to become a faculty, but unfortunately, I dream of coming over. So I have to repay them. Of course, that was the agreement, but that was my dream. But then it coming over here, moving to other country, not just Australia, involves financial, you need money. So I was thinking, if I have to come here with no assurance of be able to stay, because way back then, clinicals are very, very hard to, even up to now, very, very hard to pass. So I said, the easier pathway is on a student visa. But the thing is, what do I have to study? So me and my sister were discussing on that aspect, on that particular time in 2014, that what should I have to study? But then the nearest and the closest course that I can study with being having a medical degree back in the Philippines is nursing. But having said that, I was thinking, no, I don't want to become a nurse, because we see how we treated, me myself being a guilty of that one, how we treated our nurses back in the Philippines, that they are considered as a second-rate citizen back in our hospital. Always the doctor are the dominant ones, and always the doctor are the one who make the choices, and not the nurses will just follow. So I said, I don't want to be like that and being told by the doctor to do this and do that. However, when I got here on a student visa, I got enrolled in one of the university, and good thing that instead of doing the 3-year course, they only asked me to do the 2-year course, because they were able to credit some of the biochem, the pharmacology, those sort of thing. And they made me one of the tutor in the university. So that's how I sustain myself. However, coming to Australia is not an easy task. You have to swallow all your pride. To tell you honestly, to be honest, when I came here and did my on a student visa, the very first job I took was being a caregiver. So in 2015, I was a caregiver attending to 2 clients who are quadriplegic, just to earn money to pay my rent. So the rent here is on a weekly basis, not a monthly basis. So, and I was just staying in a room. So just imagine, I am already a doctor, a registered doctor in the Philippines, came on Australia to have a better life. And then imagine I was only riding a bicycle because I don't know how to drive a car by then, because car in Australia is a necessity, it's not a luxury. So it is not to show off to everyone that you have a car, but here it is a need. So I don't have the capacity during the time yet, that time. So I have to use the bicycle, and then go to my clients' houses, washing their dishes, showering them, wiping their bum, evacuating their manually because they're quadriplegic. They couldn't open their
Wow.
bowels on their
Wow.
own.
Are you studying
That was
nursing back then while you're working?
I was studying back then, at the same time preparing my AMC 1.
Wow. So you're
That
doing
was way
things at the same time,
I
working,
did.
studying,
Yeah,
and studying.
yeah. So
Studying two
that's why I
things.
want that's why
Wow.
I want to share to people that it's not easy, but it's not impossible.
It's doable.
So it's doable, correct. So I studied there, I finished, and then I finished nursing, and then straight away, without even before my graduation, I've already had a job offer. So because after my caregiver, I got an offer to become a phlebotomist, so taking bloods. So I stayed on that one as well until I graduated nursing after in 2017. Before I got my registration with APRA, being a nurse, I already got a job offer in cardiac catheterization in cath lab. So because of my background, so if you are on the same boat when you got here, make sure to use what you have back in the Philippines and don't lose hope. That's what the only thing there. Even though you will sometimes question yourself, what am I doing here? In when you get the chance to come over here, but I will explain to you later what's the easier way now to come here, not to go through what I've been through. So you can there's a better pathway. But that's what it's just a little bit of sharing that it's not all happiness when you come here. But eventually, so what did I do that? Because I knew few people who were already working as a GP here in Australia since 2009 were asked to go home because they couldn't pass the clinical exam. Just for the information of everyone, once you are on a limited registration, being a medical practitioner with APRA, you're only allowed to renew your registration 4 times if you're on the limited registration. Once you're on the last stage, on the last chance of the limited registration, you need to either go to provisional or general straight away, because you being on a limited registration is under a working visa being sponsored by the employing company or the employing practice cannot employ and give you a working visa anymore if you don't have any registration with APRA anymore. So that's why I knew 2 GPs who were asked to go home because they couldn't pass the clinical exam. So what I did is, because I'm not that good and I don't have any Australian experience, I used my nursing career to gain the permanent residency. And then when I get my permanent residency, I went back. I didn't really went back, but I I actually decided to stay in the nursing because I was enjoying it. I have more power than the doctor at the cath lab. So I can tell doctor, no, don't do that. That's not one of the standard, this other thing. So just for this is a different side topic, but the nursing here has more power than the doctor working in the
They're well
hospital.
recognized, they're well respected,
They are
they have
respected.
more experience, they know what they're doing.
Exactly. And they knew that because we doctors, especially we junior doctors, we are rotating to different units. And at most, we are only there for 10 weeks. And then these nurses has been there for years. So they will tell us what to do with the patients, those sort of thing. Now, yeah. So in 2020, after the COVID, during the COVID, I got sponsored by in 2019, I got sponsored by Queensland Health on a working visa being a nurse. And then in 2020, I got my permanent residency sponsored by the state of Queensland being a nurse. And then in 2021, I was able to do my citizenship. So it took me at least probably 6 years or 7 years, that process. It is a long road, but I didn't regret it.
Very good.
Sometimes,
Congratulations.
thank you. But sometimes I always question, why am I doing this when I should have been working in the Philippines, having this prestige, having this honor, having this respect from people that I'm a doctor, I'm well, this and this. Why am I here in Australia dealing with all these hardships and all these things? But eventually, when you get to where you want to be, you will feel very satisfied and you will look back. Oh, I've done that. I was able to survive these hardships. I didn't know those sort of things. As long as one thing, you need to be humble. Humility is very, very important. Always make sure that think that you're still lucky compared to the rest. I always tell that to myself before, even though I was mapping the floor of my client and everything. Why am I doing this here in Australia when I was supposed to be a doctor back in the Philippines? But I always think I'm still lucky because there's a lot of doctors or nurses that are wanting to come Australia, but they don't have the opportunity. I'm already here because I'm very this close to go home and quit. Yeah. So that's it. Now
Wow.
going back to the process of the AMC and accredited as a medical practitioner. So I've already been working. I'm already now considered as a senior clinical nurse in the two hospitals where I am at the moment. In
Where are
cardiac
you
catheterization.
exactly? Which
I'm in Townsville. Yeah,
Townsville, but beautiful.
yeah.
I've been to Hervey Bay. That's it.
That's a bit
And Fort
a bit
Douglas.
down near
Yeah,
Brisbane. Yeah,
Fort
it's more of
Douglas.
the
I've been
north.
there for a weekend
Yeah.
conference.
Yeah, Fort Douglas is a bit far from us, about 4 hours drive and 5 hours drive from where I am, north, Dr. Vanessa. Anyway, so now what am I gonna say? So I was already I was a clinical nurse. So a clinical nurse is sort of an educator in the nursing field. So I was doing it in ED and in cardiac cath lab, the heart attack unit. So the one that really prompted me to go back to medicine is my director in emergency. So he saw when you work from your heart and you dedicated your service,
Mm.
when you work from your heart and we are all Filipinos are really like that. Not I haven't met anyone who are very lazy and those sort of things. I think when you come to the other country, you will still bring your being a hard worker and those sort of thing. And that's one thing that I'm very proud of us because people will really notice it. They will really notice it. No matter as long as you work and you work from your heart and you work it sort of like not complaining, not whinging. Of course, you need to whinge and complain sometimes if it's especially if it's your dignity and your self being disrespected by other people. You will met those situations as well, but you need to stand up for yourself. Um, so it was my director of emergency, the clinical director, which is consultant in emergency, asked me, texted me one night while I was working. He said, do you want to go back as a medical doctor? We will be happy to support you. But I said, I'm already happy with my being a nurse. At the same time, I don't have the money. I don't have, so I've already passed AMC 1 during that time. I passed AMC 1. By the way, going back 2016, while I was doing nursing, remember I've also studying AMC MCQ. So I passed in 2016. I got an offer as a GP in one of the location in Brisbane. I sat for a pesky, but I failed. So for the information of everyone, a PESCI is called the pre-employment simulated clinical interview. It is a requirement for us GP who hasn't passed the clinical 2 yet to get registered with APRA if you'll be working as a GP under a supervision. So I didn't pass that exam. So I said, look, I'm gonna continue being a nurse because I don't have assurance that being a GP will give me permanent residency. So I just set my medical degree set aside and continue my goal of getting my PR. Now, this time, it's a lot easier now for you guys who are aspiring of coming to Australia is what you'll have to do is you need to go through the Australian Medical Council website. So basically, I don't know whether Dr. Vanessa has already showed it on the Facebook group of what's the pathway of coming over here. So you have two options. You got the standard pathway and then you've got the specialist pathway. I am not discouraging anyone who are already a specialist in their own field back home in the Philippines, but it's really hard to get accredited as a specialist in Australia coming from the Philippines. So if I were you, don't waste your 12 grand paying to the college to have your credential accredited as a specialist because they will just say, no, you are not comparable to the Australian standards. So, and this is coming from, because I work in a private sector at the moment in the private hospital. So I've been rubbing elbows with all the specialists, and some of them specialists are coming from different countries. One is coming from South Africa, and he's an ENT, and he said to me, it I think he paid almost 30 grand to have his credentials being approved by the ENT college to be comparable to the Australian standards. And in fact, South Africa is already considered comparable with Australia, UK, London, New Zealand,
That
Canada.
and we're partially comparable, depends on the years of your
Oh,
consultant
yeah.
job. So
Mm.
you can still do the specialist pathway because that's what I did, and we can still
Oh,
be partially
oh,
comparable
good. Yeah,
and
yeah.
still work towards the training, upskilling to get accredited.
And this is for the obstetrics, Dr. Vanessa, isn't it? Obstetrics,
Radiology.
which
I'm a
radiology?
radiologist.
Oh, yeah. Yeah, so I think the radiology is because I know few people who was able to come here as a specialist on the radiology college. I think it depends on the college,
Depends on the
but
college and depends on the person. So I will post some videos again about
yeah.
radiology pathway. So continuing your journey.
Yeah. So, but the easy one now is a standard pathway. Now, after the COVID, Australia has a little bit more lenient and flexible with the Australian overseas trained doctors. Why? Because we need a lot and heaps. We still need a lot of doctors. And the supply does not meet the demands at the moment with regards to the healthcare system in Australia. So that's why we are now on the recruitment. So I am having worked in a public hospital as well. They've told me that they are now a little bit opening the Queensland Health as well. If you look into the smart jobs of Queensland Health, which is a state of Queensland, you could see there that there is an ongoing recruitment for overseas trained doctors casual pool. There's a pool that they are recruiting now. That is now an ongoing recruitment. So even you, as long as you pass your AMC1 MCQ, you will have a high chance to get employed here in Australia. So one is pass your AMC MCQ. Two, you need to have a recency of practice, at least work in the Philippines for at least a year. Then that will give you a little bit of ticket to be able to apply to some hospitals who is in dire need of doctors.
Preferably in emergency, preferably moonlighting, yung mga
Correct.
mga moonlighting
Yes.
sa mga emergency department. Basta
Mm-mm.
meron kang active ang clinical mo. You'll have
Clinical
more edge.
experience. Yeah. So what you'll have to do is to do the standard pathway. I think you need to go through the portfolio, making the portfolio, having your credentials accredited by the ECFMG and those sort of things. It's all in there. So just make sure to tick the boxes for the AMC MCQ. Do all the reviews and the reviewer, that reviewer, the MCQ handbook of AMC. That's very, very helpful because it will give you a format of what the exam is all about. And then once you pass that, you are very close to be able to come to Australia because a lot of hospitals now are needing doctors even on the limited registration.
Even
So
just AMC
see,
one,
AMC
especially in
one,
the
yes,
rural, it's
yeah.
very flexible. I mean, there's more chances to get in, but you
Mhm.
just need to pass AMC one and fix your CV. You need to
Yeah,
highlight
fix
good.
your CV, those sort of thing, and then um yeah, so once you get that one, there are still some hospitals that you need to apply. So clinical two, blah blah blah, those sort of thing. So with the clinical two, the AMC clinicals, it is still a bit of disheartening because at the moment the passing rate is very, very low still, which is fair enough. I could understand why they are doing that because one, more money. It's always been having been having been here for Australia and been through the process and everything. Every single move that we do as overseas trained doctors or even overseas trained professionals, it involves money. Can you imagine if you will have to take any past an IELTS or PTE or an OET sort of thing? It has an expiry of 2 years. You mean to say your English proficiency will expire in 2 years as well? I just don't get it. But money making. Let's just face that reality. So,
So,
and
kailan
I'm
ka
very, very,
nag-AMC two?
huh?
Kailan ka nag-AMC two?
2022.
Okay.
So,
So,
what it was, so my story of AMC2 is not really thing as well because um I wasn't, I was happy being working as a nurse already back then, in June 2022, but I got an extra money. So when you work here as an employee, you have that what we call salary packaging. So the salary packaging took a lot of over excess deduction on me, and then they found out that they are over deducting me. So they said, oh, we have an extra $4,000 that we deducted on your account last year. I was like, oh, what do we have to do? We'll refund it back to you. So they refunded it back to me in one spot. I have enough money to pay for the AMC too. So I said, Lord, this is my last money. I will gamble this. If I will not pass this clinical exam, that's it. End of my medical career. End of story. Because I'm not gonna do it again. Because I've know a lot of people who didn't make it 4 times, 5 times, sort of thing. This is not to discourage everyone. And we do different path, we do different road. Yours might be different from ours. So, or the rest of the people who took it multiple times. But when you took it and you didn't make it, don't lose hope. The reason why I'm saying this, mine, if because I don't have the money. That's why I just like, I'm not gonna take it again. But if I have the money, then I will continue taking it. But fortunately, I passed it in my first attempt. Um, so yeah, so my experience working as a nurse helped me a lot because clinical exam, guys, is not a test of knowledge. It's a test of your personality as a doctor. It's a test of how you communicate. So communication is very, very important in clinical too. AMC1 is based on knowledge, but not all the time that the knowledge we learn from what we learn from our respective medical schools where we graduated. It should be a knowledge of how the Australian healthcare system and the Australian guidelines are being done. We are always being we are always following a guidelines. So your colleagues will question your management if you will give this antibiotic and give this antibiotic. It's like, why are you giving this antibiotic? This is not in the guidelines. So we are always following the guidelines, not on your own gut. Like, for example, back home, this is when I realized here the difference between how we practice back home and how we practice here. If you have a patient that has a cough or sore throat for 3 days, blah, 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 azithromycin once daily times 3, blah, 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 or ciprofloxacin, 750 milligrams. Yung 750 pa talaga ang inano for 3 days. Here, you cannot just prescribe antibiotic left and right. It is very regulated. And these are the things you need to know when you study for your AMC1, because the way it is being asked is according to the Australian guidelines. So if you get the chance to, when you are preparing, now we are talking now in preparation for the exam for AMC MCQ and clinical one. Is that okay, Dr. Vanessa? Or how you, yeah, or
So,
you've got other
kung
things?
mawawala tayo kasi in 2 minutes,
Yeah,
let's put it in suspense. Let's
yeah.
go out and log in back again so that we have another 40 minutes of recording. So,
Okay.
let's cut off for now and
What's
then
the
let's
question that they
continue.
have to do? It is 4 years for asset natin. Masipag tayo sa exam.
Wala naman ako yan.
Ah, there's an
Ako
Arch
lang yan.
direct message. There's one direct message from Arch. Is it a 4 years worth of limited registration, doctor? Yes, it is. You here, Arch, we need to renew our registration every year. And
Yeah.
you're allowed for a limited registration, only allowed to renew 4 times.
So let's go out and log in
Yeah.
back again and we'll try to answer more questions later on. Okay, see you
Yeah.
everyone. Log back in. Thank you.